civil and environmental engineering. I should tell you that his research projects are many, as publications as well. I selected two, and I thought I would just give you the titles of those so you have a little bit better understanding of his background. One of his research projects and publications is entitled Sources and Risk Factors for Nitrate and Microbial Contamination of Private Household Wells in the Fractured Dolomite Aquifer of Northeastern Wisconsin. Another one is Human and Bovine Viruses and Bacteria at 3 Great Lakes Beaches, Environmental Variable Associations and Health Risk. So you have a little bit of his background. He tells me his presentation will probably go 40 to 45 minutes. Once he finishes, we'll have a question and answer period. I think we can hear folks here. We've got this owl device. I've seen it now for the first time, and it rotates so that it can take a picture of you, get you on video, as well as pick up your voice. And I'm hoping that all that works well. So if you would speak up when you ask a question later on, that would probably be very helpful. Are there any questions before we start? If not, I welcome all of you and I say hi, Dr. Burch.
Thanks, Mike. Thanks everyone for attending. Appreciate the chance to talk and appreciate the interest in our group's research. The talk today is on health risk of waterborne pathogens in private wells. This is research that probably a lot of you, maybe all of you, are already aware of. And it's conducted in Kewaunee County. It's relevant here in Door County, I think, because there are areas with similar thin soils, similar hydrogeology, fractured bedrock aquifer, and similar land uses. There's a lot of ground to cover in this talk, so I'm going to just jump right into it. If Zoom lets me. I think I'm going to be fighting these controls the entire time. There you go. Probably everyone knows the background slides I'm going to show, but it's worth it just to make sure we're on the same page here. Kewaunee County, of course, next county south of us, population of roughly 20,000, 12,000 of whom rely on private wells for their daily drinking water. There are thousands of private septic systems in the county, tens of thousands of cattle. Many of them are located on CAFOs. Dairy cattle, those are farms that have 1,000+ dairy animals on them. It has vulnerable groundwater, fractured bedrock aquifer, and in places thin soil, some places very thin soil. On top of that, vulnerable hydrogeology, 2 major fecal sources in the county. One is private septic systems, the other is dairy manure. So I have to look at this to make sure on your left, every one of those green dots is a residential septic system in the county. So you can see they're obviously widespread throughout. And it's probably not a perfect one-to-one, but in many of those places, basically right next to every one of those septic systems is a private well. The map on the right, the pink shading, those are all fields that have nutrient management plans. That means those are fields where manure could be land applied in theory. And the green squares are manure storages, so things like lagoons. The point being with this slide that at least categorically, both of these fecal sources are widespread throughout the county. So our conceptual model for what's going on here is essentially 2 sources of fecal pollution, 2 populations of mammals, I guess, on the landscape, the humans and the cows, connected by the groundwater. This is, in my opinion, a fairly classic example of Garrett Hardin's tragedy of the commons. You have a public resource with no inherent penalty for degrading it, yet everyone relies on it. This also fits a One Health model where you have the health of animals and people connected by the environment. There you go. That's just the background on Kewaunee. The talk today, everything that I'm going to be talking about is published. It's in these 2 papers right here, Environmental Health Perspectives. They came out July of 2021. I think I get my years mixed up a little bit once in a while. They're companion papers. They go together. So the top paper there, I think Mike mentioned it in the intro, that one was led by Dr. Mark Borkhardt, long-term collaborator, now retired. And then the bottom paper led by me, that's the microbial risk assessment. The way the talk is going to be structured is I'll spend a little time reviewing essentially the results from this first paper because they serve as background for the risk assessment. And then the focus of the rest of the talk will be on that bottom paper, the risk assessment. That's work that has been, we presented it around the state. We haven't really presented it on this side of the state yet. So that may be relatively new for this audience. The research objectives of those two papers, you see them listed here. Essentially, the first three objectives are all in that first paper. Mark and I have had many discussions over the years about being lumpers versus splitters. Mark's a lumper and I'm a splitter, so his paper's got 3 objectives in it, mine's got 1. The first objective is to just quantify the extent of contamination, looking at nitrate and bacteria from a randomized selection of private wells in the county. The reason we do this is there's state level data, but it's collected in kind of an ad hoc fashion, so it's hard to tell if it's really representative of what's going on in the county or not. We wanted to take an actual randomized study design to the county and get a good number to compare to what we already had. Objective 2, for the wells that we find to be nominally or categorically contaminated, that means wells that test positive for coliforms or test positive for nitrate above 10 milligrams per liter. We want to relate that contamination back to source-specific microbial markers for human fecal contamination. That would be contaminants coming from the septic systems versus bovine fecal contamination. That would be contamination coming from the dairy manure. The way we do this is using an approach called microbial source tracking. We can measure microbes that are specific to either human hosts or bovine hosts. And if we find them in a water sample, we can say this is where the contamination came from. It came from this host. Objective 3 is relating, again, the contamination, the nitrate and bacteria contamination to land use and other landscape scale risk factors that represent source and transport of those contaminants. The reason being that informs, if people are interested in it, that informs policy and management at a landscape scale, at a county scale. That's a step towards identifying solutions. So not just saying, hey, there's a problem here, but looking at ideas for things we could do to mitigate the problem. And then objective 4 is quantifying the risk of illness. So this is if you're drinking this water contaminated by waterborne pathogens, how likely is it that you're going to get sick? So for walking through those first 3 objectives, I'm just going to go there's essentially 3 major lessons, 1 from each objective. And I'm just going to walk through those in the next couple slides. So for objective 1, what we learned, as it turns out, the countywide contamination rates for coliform bacteria and for nitrate, when we did the study, they were actually similar to the state averages that we had going into it. But there are also hotspots, so to speak, within the county. These are areas that have shallow depth to bedrock. That means they have thin soil over the aquifer. Those areas have higher contamination rates. These are the data demonstrating that from the study. The first 3 rows here in the table, that's from the study. Actually, the first 4. And then that bottom row, that's the kind of larger statewide data that we have access to. So looking at these, what you can see is total coliforms, the percent of wells contaminated by total coliforms is highest in the thinnest soil when we have less than 5 feet depth to bedrock. And then of course, intermediate 5 to 20, and it's lowest at greater than 20 feet. Same thing with E. coli. Nitrate has kind of an odd relationship, but if you lump the 5 to 20 and less than 5 together, you still get that decreasing trend with increasing soil depth. And then the overall rates in the last column, total coliforms or nitrate, that shows you kind of that in terms of the data, this clean pattern of the highest contamination rates are in these shallowest, or in wells drilled in the shallowest soils. Second lesson, both fecal sources, the septic systems and the dairy manure, both fecal sources contribute to private well contamination. And just to re-emphasize essentially the lesson, the first lesson, shallow depth of bedrock makes it more frequent. So there's two slides to kind of demonstrate these results. This is a big list of everything we detected in the table. And you can see there's a column here, the first column, host specificity. So we have some human specific markers. We have some bovine specific markers. We found both types of markers. We tested for a lot of bugs, 32, we found 19, there were 13 that were not detected. They're listed in the footnote there. And then if you're looking at number of wells contaminated, 44 contaminated by bovine manure, again, based on the data in the table I just showed you, 33 by human wastewater, 9 wells had both. Slightly more bovine, but still kind of same order of magnitude in terms of the number of wells that are contaminated. And the third lesson, there's a lot of factors that affect contamination in the wells. Of factors that can be controlled, land use is the one that we found most often associated with contamination. To show you what we considered for factors, we had, I think it's 54 if you add them all up, 54 individual risk factors. We can lump these into 4 groups that you see here: land use, hydrogeology, precipitation, and well construction. What we did was, with our contaminant outcomes, we took all 54 risk factors and basically ran all the statistical tests to see which ones associated with the different contaminant outcomes we were looking at. So for instance, nitrate concentration, probability of detecting nitrate, probability of detecting coliforms, the concentrations of all the source-specific fecal markers. It's a very hefty modeling effort. You end up with 28 models to look at the end. And this is an extremely high-level summary of this. If you take those broad categories and look at how many of each made it into one of the models at the end, this is what you get. I've split out land use into the ag and dairy manure versus septic systems. We had individual factors for each of those two. And what you get is basically that land use shows up 6 times, hydrogeology shows up 9, precipitation doesn't show up in any of them, well construction shows up in 2. You can't really control your hydrogeology, not directly. I mean, you can control where you drill your well, but once the well's there, you can't do anything else about it. Can't control when it rains. You can, to a degree, at least. It's not easy, I know, but you can control land use. So this is why I say, of the things you can control, land use is the one that shows up most frequently. So that's all the first paper, the first 3 objectives. Objective 4, why study health risk? I'm basically just pulling out a little bit of that conceptual model that I showed you earlier. And this is essentially what our research question is. We've got the data on contamination rates. We know what bugs are there. We measured pathogens, so we know which pathogens are there. I think one of the obvious questions that people ask all the time is, so if we're drinking this water, then can we expect people to be getting sick, or what level of illness would we be expecting countywide? So the way we approach this question is we used a technique called quantitative microbial risk assessment. And I'll say a little bit about that in terms of how it works. But first, I just want to define what I'm talking about when I say health risk. And I'm using an example here, not related to waterborne pathogens. So the dictionary definition of risk, if you look at it, is possibility of loss or injury. And you can peel that apart into essentially 2 components. One is a probability. One is the damage that occurs as a result of being exposed to a hazard. So the figure here illustrates the difference between a hazard and a risk. A shark in the water, if you're standing on the beach, is a hazard. It's out there, it could hurt you, but you're not actually exposed to it. If you get into the water and go swimming and the shark is there, now you're at risk. So risk involves exposure to an actual hazard. So what QMRA is, quantitative microbial risk assessment, this is estimation of risk, so the probability and the damage for microbial hazards. The hazards that we're looking at are usually either foodborne or waterborne pathogens like Salmonella or Cryptosporidium. And the damage that we're looking at are different health outcomes like infection. You can carry pathogens asymptomatically, that would be an infection. Also symptomatic illness. Acute gastrointestinal illness is a specific form of illness that we look at. It's some combination of vomiting, diarrhea, and other symptoms. AGI is what we looked at in this study. It's often self-limiting, but it can be very severe in immunocompromised hosts and other susceptible hosts like the very young or the very old. Procedurally, 4 steps in a QMRA. And really there's 3 pieces of information. It's for a drinking water QMRA, it's the concentration of the pathogen, it's the amount of water you drink, and then it's the dose response relationship that the pathogen exhibits. So if you swallow 1 cell of Campylobacter that has a different dose response, a different probability of making you sick than say 1 cell of E. coli, and QMRA accounts for that kind of thing. So those 3 pieces of information get incorporated in these 4 steps. Hazard identification is looking at what's there, which pathogens. And the exposure route here is drinking water. Exposure assessment is defining what the daily dose is. So that's taking the pathogen concentration and just multiplying it by the amount of water that people drink. Dose response assessment is basically just a lot of math, and there's published models for that and published formulas. Risk characterization and then is putting all of that information together, depending on the outcome you're looking at, like in our case, illness, AGI, and then also assessing the effects of variability and uncertainty, which I'm not going to go into the technical details here, but we do that using Monte Carlo simulations. The important part for this study is that those steps 1 and 2, that's using all field data specific to Kewaunee County. So the kind of alternative example, and this is fairly common with this approach, is to essentially assume what's there. You know, if you assume so much Cryptosporidium in the water, here's how many people get sick. We don't have to make the assumptions. We've got the lab data. This is all based on real measurements, real data going into the dose response models. So this is all based on the sampling that's described in the first paper that I showed at the beginning. The hazards that we looked at, the specific pathogens that are included, you can see listed there. This is, for the most part, the majority of waterborne gastrointestinal pathogens that you would be concerned about. Just in a general sense, we detected all of these to varying degrees. Other than norovirus, that may be one that folks are familiar with. We never detected norovirus in the study, so it didn't go into the study. That's an example of how we're using the real data from the field. For exposure assessment, there's really 2 pieces that are important here in terms of how we did our exposure assessment. Well, two factors that we stratified the exposure assessment by, because we knew it was going to be important from the beginning. One is depth of bedrock, how thin or thick are the soils above the aquifer. And the other is fecal source, bovine, human, or in some cases unknown. So these source-specific fecal tracking techniques that we use, you can't always tell. Sometimes you find both sources in a well, and you can't really say definitively which one a pathogen came from. Sometimes you find neither, and there's still a pathogen there. And so again, it probably came from one of those sources, but we don't have perfect sensitivity, so you can't always tell. But for cases where we could tell, we categorized the illnesses that we're estimating as being either bovine, associated with either bovine or human fecal material. And I'm gonna skip over the other two steps because those are, unlike the first two, essentially cookbook in terms of the QMRA methods. And the results, there's a fair amount of material to work through, so I just kind of wanted to stop and show you what I'll be talking about. The first thing I'm gonna talk about, those first two items, they're essentially intermediate results, showing you results from the exposure assessment. But they're important to interpreting the final results. So that's why I'm gonna spend a little time on them. So we're gonna talk about how we estimated how many people are exposed each day to pathogens in their drinking water based on depth of bedrock and based on fecal source. And then I'll also talk about the average daily doses. Item 3, risk, that's kind of the main result. And there's a couple different ways to slice that up and look at it with respect to the factors we put in. So there'll be a few slides on that. And then there's a fair amount to talk about in terms of putting the results in context and the implications. One of the hardest parts with putting this study into context is it's very novel. There's really no other study out there like this right now to compare to. So it's just hard to compare. We do our best, but there's nothing out there that has the combination of risk assessment with the source tracking yet. We are working on that. It won't be the last. So preliminary results, people exposed per day. This is a big table, but it illustrates essentially how the calculations work. So if you start on the left, we've got our 2 depth of bedrock categories, less than or greater than 20 feet. Within each of those, the 3 different fecal source categories we're looking at. And you can see for each depth of bedrock category, how many wells there are in the county that fall into that category. So 680 wells in the county that are drilled in thin soil, relatively thin soil, over 4,000 drilled in the thicker soil. The contamination rate by depth of bedrock, what that is the percentage of those wells that are contaminated by either coliform bacteria or nitrate concentrations greater than 10 milligrams per liter. And consistent with the results I showed earlier, it's higher in thin soils and lower in the thicker soils. Then within each of those categories, for each fecal source, the percentage of the contaminated wells that are associated with one of the fecal source categories. So bovine, human, or unknown. We assume based on US Census data that there's 2.5 people per well. And if you multiply all those numbers out, that last column there is the people exposed per day in each of these stratas. So for each fecal source and each depth of bedrock category. The total is 3,000. And then you can see how it varies by depth of bedrock and fecal source. I'll come back to this later. The thing that I think is interesting here is I treat this like an intermediate result. It's just always in my head that it's not the main thing we're interested in. Somewhere a couple of years ago, I was doing an interview with a journalist, and the journalist was really focused on this table. And it kind of made me realize that this in itself is an interesting result. And I think you'll see how that comes into play when we interpret the risk results later. Average daily dose. I'm not going to show you every dose estimate that we came up with because there's just so many. There's 48 different combinations. 2 depth of bedrock categories, 3 fecal sources, 8 pathogens. So there's 48 different combinations of daily dose that we're estimating. And what I'm showing here is essentially a very small number of those 48 are a daily dose greater than 0. If dose is 0, risk is 0. So in 37 cases, we said dose is 0, risk is 0. In 11 cases out of those 48, the dose is greater than 0, and so there's some non-zero risk. My point here is we're not trying to blow the risk estimates out of the water. They're very realistic. If there's evidence that risk is 0, we say risk is 0. And then this is the first of a couple slides that look like this, looking at the actual illness estimates, the risk estimates. So this kind of first pass at it, we're looking at annual estimated cases of AGI per year in the county. So this is among the population that's consuming their water from private wells. So among the 12,000 private well users in the county. We've got it for each pathogen, and then the bottom row there is the total, the sum across all pathogens. So that's the overall number, about 300 cases per year in a population of 12,000 people. You can see how it splits up then by pathogen. There's a lot of variability. So some of these pathogens, they're there, we detected them, but they're responsible for a small kind of overall burden of the risk, either because they occurred at low concentrations or they occurred infrequently, or there are some, pathogens vary in their dose response characteristics. So some pathogens are very likely to cause illness when you're exposed to them, some are not. The big one to pay attention to is Cryptosporidium parvum. That's obviously the single largest contributor, and that will come into play in a couple other slides. The next way we're going to look at this, same total cases of illness, same 300 illnesses, but now instead of, we're combining across all the pathogens, but now splitting it up by depth of bedrock. And this piece may be a little bit surprising, right? Wouldn't you expect the highest risk to be in the shallow soil because it's more vulnerable? I think I'm hearing people whisper the correct answer out there. But that's not the case. There's more illnesses estimated in the thicker soils. And that comes back to the number of people that are exposed each day. So this is the same table I showed earlier, but I've taken a lot of the columns out because I just want you to focus on the pieces that are important for this explanation. So again, looking at our 3,000 people exposed every day, yes, the contamination rate is higher in shallow depth of bedrock, that's up there, but there are so many more wells drilled in deeper depth of bedrock that it essentially compensates for it and then some. So it's lower risk, lower risk per person, but many people exposed to that lower risk is actually a larger burden than a smaller number of people exposed to the higher risk. And then we can look at estimated cases, again, the same 300 cases by fecal source. So of the 300, I think the number is about 240. Now that I took it out of the table and put it at a bar chart, on a bar chart, I can't read it exactly. 240 associated with bovine contamination. I think the number is 12 associated with human contamination. And then a fair number, 50 to 60 in that unknown category where we couldn't associate them with one fecal source or the other. I have to think about what my next slide is here. Oh, yes, okay. So now the question is going to be why bovine, why not human or unknown? Well, what the QMRA accounts for, in addition to the number of people exposed, it accounts for, where those exposures happen and the kind of net effects of how pathogens vary in their fate and transport and also their dose response characteristics. So what it comes down to is the probability, so there is a little more exposure to bovine contamination compared to human in terms of the number of people exposed, but really the main thing driving this is the probability of illness per exposure for a well contaminated with bovine fecal material is much higher in this study based on the data we have than the same probability for a well contaminated by human fecal material. So I think I forgot to put the number up here, but it's about a 30% probability per exposure of an illness if you're drinking water from a bovine fecal, a private well contaminated by bovine fecal contamination. It's about a 3% probability if it's human fecal contamination. And what drives that is the pathogens associated with each fecal source that are contaminating the wells. So what we're looking at here is pathogen detections by fecal source. This is the percent of samples that tested positive for each pathogen. And it's split up by the same fecal sources I've been talking about in terms of how the QMRA is split up. The biggest number on there is the Cryptosporidium parvum number. So we found Cryptosporidium parvum in about 17% of all our samples. The second biggest number is Salmonella, 12%. You may be wondering why weren't there so many Salmonella cases? So the Salmonella detections tended to occur in the shallow depth of bedrock category. So they affect fewer people, even though there's a lot of detections there. The Cryptosporidium parvum detections, in addition to being associated with the bovine fecal material, also tended to occur in the deeper depth to bedrock category. So they affect a lot more people. So that's what's going on with that number. This is why the bovine number is so high compared to the human number. Okay. That's all the results. That's a lot of results kind of sliced up many different ways. So what I want to do now is just kind of step back and think about some of the questions that this probably brings to mind. And the first one, it comes to my mind, I think it's the first one that comes to many people's mind, is risk high or low? This is kind of what I alluded to at the beginning. The context here is important, putting those numbers in context, because we're all exposed to risk every day. People get sick. It's hard to tell just looking at these numbers on their own if that's high or low. It's tricky to answer, but it has to be done, so I'm going to do my best with it. The short answer is that defining what's acceptable, which is a threshold you would need to say if these numbers are high or low, defining what's acceptable, that's a subjective and collective process. So I can't stand here on my own and tell you all these numbers are off the charts, or these numbers are really low, or these numbers are average. I can't give you that answer. You have to bring your own value judgments. The other part that makes it tricky, in addition to it involving a value judgment more than just science, is that right now, because again, this study is so novel, the scientific evidence that you could use to judge this is it's equivocal. There's multiple ways to interpret it. So I can give you the information and give you the context, but you all have to take it the rest of the way. So the first thing to talk about here with trying to determine, are the risk estimates high or low? There is no standard acceptable risk number for private wells in the US. It just doesn't exist. There are two other benchmarks that are commonly cited in the US research literature that are informative. So they're at least helpful for thinking about this. One is for public drinking water systems. So not private, but public. And this would include public groundwater systems, but also public surface water systems. That acceptable risk benchmark, and it's EPA's benchmark. It's baked into many of the water regs. Is 1 infection per 10,000 people per year. They say that anything over that, well, they say that that's essentially the goal. That's what they want public water systems to be operating either at or below that number. The other benchmark is for recreational water in the US. That benchmark is 32 illnesses per 1,000 people per exposure event, where with a rec water exposure, that's essentially 1 day swimming. These are two really different benchmarks in terms of how they're defined, but also just quantitatively. I mean, one's looking at risk in a day, and one's looking at risk over the course of a whole year. So I've tried to capture that with a number line, and you can see just looking at the range of this number line, how far apart these two benchmarks are. So the drinking water benchmark is on the left here, 1 infection per 10,000 people, and you can see that on the bottom scale. The rec water benchmark is on the right, 32 illnesses per 1,000 people, and you can read that on the numbers on the top scale. The risk number that we're getting for Kewaunee, the 300 cases of illness per 12,000 people in a year, is right smack dab in the middle. The study is novel for looking at private wells, for doing the risk assessment with the source tracking. and for being site-specific, meaning for looking at something at the scale of a county. There have been national level assessments, both in the US and Canada, for drinking water. Those are informative, so we can put those up here. The blue line on the bottom is the range that's been determined for public water systems in the US. That number is obviously not achieving the 1 infection per 10,000 people per year, but this is the estimate for US public drinking water systems. The red line on top, that range, that's the Canadian range, again, for public drinking water systems. The red circle is private wells in Canada. Again, a national level assessment. So Kewaunee right in the middle of all of that. And again, there are two ways to interpret this. I can't tell you which one is right, which is dissatisfying. It's dissatisfying for me. I'm sure it's dissatisfying for many other people listening to this. You could either look at this and say, well, everybody's drinking water is unacceptably high. It all needs to get fixed. Or you could look at this and say, well, Kewaunee falls in the middle of the pack for the other systems that we know about. I really can't tell you which of those is right. I will come back to this. So I can't tell you essentially if risk is high or low. I can tell you if you think risk is high, I can tell you which factors associate with risk and how you could achieve risk mitigation. So I'll come back to that at the end. But a couple things I want to address before that. One of them is, are the risk estimates realistic? There is, we're basing all of this on empirical field data. That's a strength, but there is still some modeling, some assumptions built in. So we do need to ground truth our estimates. And so this is a reasonable question. Are they realistic? Yes. We have two lines of evidence. One is that we can compare to AGI rates for essentially all sources and all transmission routes. That means foodborne, person-to-person, animal contact, in addition to waterborne. If you look at what US data, national level data say, they say we could expect 650 cases of AGI per 1,000 people per year. If you were to extrapolate that number to Kewaunee County, the 300 cases we're talking about would be about 4% of all of the AGI cases in the county in a year. So I say it's realistic because we didn't get 400% of the expected cases. We're in the right ballpark. Here's the other line of evidence. We can compare our risk estimates for some of the individual pathogens to reportable disease data in the county. The one caveat or important qualifier being, you have to understand that county level data for reportable diseases and national level, just like the national level data in the US, they're all underreported. And you have to account for that because not everyone that gets sick goes to the doctor. Not everyone that goes to the doctor gets tested. Not every test result gets reported to public health officials. There's losses the whole way. So we can look at what this is for cryptosporidiosis, for the cryptosporidium detections that we found. The reported data from the county, and this is available in state reports, is essentially 5 cases of cryptosporidiosis in 2015. 2017. At the time we did this, this was the closest value that we had. We did the sampling in 2016. If you account for the underreporting of cryptosporidiosis, which is about a factor of 100, you get 500 cases per year, and we're predicting 250. Again, it's less than the 500. We're getting reasonable risk estimates. We're in the right ballpark. You can repeat, I'm not going to show it, but you can repeat this same exercise for salmonella and you get the same general result. The waterborne salmonellosis cases that we're predicting are less than what we would expect for the total countywide cases. So yes, the risk estimates are realistic. Getting close to the end here. Implications for risk mitigation. Again, I can't tell you if you should or if this needs to be done, but if you think it needs to be done, these are the priorities to look at. The biggest one is private wells constructed in more than 20 feet depth of bedrock. Again, surprising, but that's because so many people are exposed to contamination in that strata. That's just over 80% of the total AGI cases that we estimated. are 4 private wells drilled in more than 20 feet depth of bedrock soil. Also private wells contaminated with bovine fecal markers. Almost 80% of the estimated AGI cases. And again, private wells contaminated with Cryptosporidium parvum. That's about 60% of the cases. These are the 3 biggest priority areas to look at for risk mitigation, if that's what you're interested in. So just conclusions. Basically 2 conclusions. One is that there is a risk of AGI here. This 300 cases per 12,000 people per year. There's a risk of AGI here. It's hard to judge where that falls in the continuum. It falls between 2 available benchmarks for acceptable risk that we have in the US. It's consistent with the small number of national level estimates that we have for drinking water in North America. But there is a non-zero risk associated with the contamination in these wells. And then I just went over in the last slide, there are priority areas that we can identify for risk mitigation based on these results. And you can take it one step further, going back to the pair of papers I showed at the beginning. That first paper gives you ideas for the things you could look at for specific things you could do to reduce the fate and transport of microorganisms to these wells. And I think maybe the important thing to stress here, part of it's because they're so related. I think you saw some of that in the results, but also part of it is to kind of ensure maximum effectiveness. Really, any combination of items A through C for risk mitigation would be more effective than one of them on their own. So you're gonna have questions in just a second. I just want to acknowledge this is it's a big multi-phase study. It took a long time. It's a huge team that put it together. The group that I work with on a regular basis is in that top box there. This is the Laboratory for Infectious Disease and the Environment. It's a collaboration between the Agricultural Research Service, which is me, and also the U.S. Geological Survey. And our first 2 team members there are now happily retired. We've replaced them with 3 new people, and we are continuing to work in this same field. And then the collaborators kind of outside the immediate lab group, Bernie Kiki is our statistician from Marshfield Clinic that did the land use analysis. And then we also work with Maureen Muldoon and Randy Hunt, our hydrogeologists, and Davina from Kewaunee County. Doing a study like this takes local people to work with us. And Davina was very good to work with and really helped make this study happen. So that's all I have. You can take questions now.
Yeah.
First one.
Yes, my name is Dave Kellums. I want to commend you for what you've shown us. But I see there, ask a few questions. The first one I'd like to have asked is the rates of change over a period of time. Has it been a baseline study, let's say every 10 years previous, or is it, or are you just taking a snapshot of today or the last recent years? That's the first question. And the second question is the difference for the reason I would say postulate for the high Chlorosporidium parvum or whatever it's called.
Yeah.
Why it's higher in the lower depths in the deeper soil as opposed to the shallow soil is that there's a much greater chance of that stuff running off into the fresh water. And it's lost to our measurements.
For the shallow soil.
Shallow soil.
Yeah.
I mean, it's gotta be there. And you ask, you said there's a question, and I believe you're right, that there's gotta be a reason why you don't see the numbers in the shallow soil, is because it never got down there. It ran off.
Yeah. So I'd have to think about that a bit. I'm not the hydrogeologist, but the general answer to maybe finding unexpectedly high levels of crypto under thick soil is preferential flow. So, you know, the model, it's a nice, clean conceptual model is that you've got granular media and filtration, but what's going on is you've got roots and worms and rodents, and there's all kinds of holes going through the soil. Things can flow through that faster than it would be granular media.
And from the stuff that's farther down, it never gets a chance to go anywhere else. It just accumulates. And what I'm looking for is a rate of change of increase or decrease as well.
The rate of change in illnesses, you're saying, or?
All of these, it would take someone to have a prior test as a baseline compared to this test.
Yeah.
Or to test it again to see if the rates of change of all this exposure and contaminants are rising and at what rate. And that would also suggest what to do about it in advance to prevent further contamination.
Yeah, I mean, I would agree in a general sense that it would be nice to have more information. So I've heard, yeah.
I mean, I can understand your depth of research and that you're not very well, you don't have a lot of people to deal with this, but I'm saying that I think the answers could be more definitive with over time.
Yes, no, yeah. So one of the limits is, you can't do a study forever. So we've got our point in time. And we would like to go back and do it again, because I think this is what you're getting at, is it would give you a much stronger feel for what's going on.
We want to know if it's getting worse, and if it's getting worse, we gotta do something about the stuff, the source before it gets to where it's measured.
I agree. It's, yeah. Yeah,
I understand that your study is fecal matter, but would you be able to draw the same correlations in terms of depth to bedrock and groundwater contamination from other types of matter like chemical pollution and that kind of thing?
that's it's harder, actually. So are you talking about nitrate?
Nitrates, iron, pesticide.
So this is with what we do, dealing with the chemical part of it, if there's nitrate coming from chemical fertilizer instead of fecal material, it's just much harder to do. I really haven't seen myself a good method out there for source tracking nitrate. And, for source tracking nitrate with the fecal microbes, from a kind of strict scientific standpoint, we always have to be careful to say it's an association, because the fecal microbes aren't in the chemical fertilizer. If you find them at the same time, it tells you there's some kind of association, but it's not definitive. So, yeah, I guess with the chemical part of it, it's not as easy as it is with the fecal microbes. That answers the question, hopefully.
Sure.
Okay. Yeah.
I just have a general question on all these samples that you did.
Yeah.
Are they at a point in time or approximately a point in time of year?
Oh,
I mean, that kind of seems most relevant because farms spread at certain times.
so we covered just over a year of time, 5 sampling events, all 4 seasons. The specific months and dates, I'd have to go look at the paper to get, but we covered a pretty good cross section of time. And I mean, spring and fall, if you're looking at like for the dairy manure, spring and fall, when manure is going to be there. We have periods with groundwater recharge and without recharge. So periods with and without the transport that you need to drive everything into the wells. So we got a cross section of that. I saw your hand up first.
Yeah, Tucker, thanks for your presentation. Yeah, my question is, I have been following this now for years, and I think your department is probably involved already, correct me if I'm wrong, more than 10 years in all these tests. And other departments have tested as well. I know Stephen's Point is in this. So I think in close to 20 years, we are testing. And, I hope you agree, we cannot test our way out of this problem. And based on what you just presented, if you don't have what is acceptable risk or not, I mean, where are we going with all the testing? If there is not a line, I call it a red line, that you say, enough is enough, we need to do. We're talking about people's health, thousands of people. And we, you know, this is not a problem for County County or Door. We have in a central sense, a similar problem with similar sources. However, the ground is different, it's basically sand. And they are testing and testing and testing. So my question is, where do we draw the line and say, you know, enough is enough, this is what we have to do? And I have another separate question, is could you tell us as far as wells and the construction of wells, I mean, could you tell us, is there a difference, say, I mean, we're talking about well depth, which is good to know. Does the casing depth has an influence as well? And would you like to comment on that?
So, I'm gonna take the second question first, because that was a little easier. I think maybe the first thing I want to say is that in general, in this study, well construction, so things like casing depth, well depth, was actually not all that important on a relative basis compared to the land use and the hydrogeology. It doesn't mean that, you know, in principle, having a deeper casing is bad. It's just, it didn't show up in these results. We do have our teams working on a same exact study design in Southwest Wisconsin, the SWIG study, Southwest Wisconsin groundwater and geology study. There, it turns out that well construction is a little more important. So it's still pretty early, and it's not, the hydrogeology is not my part of it, but just offhand, that would tell me that there's an interaction essentially between the well construction and the hydrogeology. In some hydrogeological contexts, the well construction is going to have a big effect. In some, like this, it seems to be less effective. The thing that controls it is that thin soils provide very little attenuation for surface contaminants, and fractured bedrock provides very quick transport. And so, you know, drilling a new well or a deeper well or deeper casings is not necessarily going to help you in that situation. The casing part, I can't answer specifically. Again, that's something I'd have to open up the paper and actually look at. Did casing depth show up in any of the results? But well construction in general was not that important in this thing. The first question, I mean, you're not going to be happy with my answer, I don't think. The policy part of it, there's a huge part of what you're asking about that has to do with policy, politics, stuff that is not science, not purely science, right? It's people's values and well, that's really what it is, people's values. I mean, I can't speak to that. That's not what I'm here speaking in my professional capacity as. So I can't tell you what to believe. What I hope scientifically, and this is why I think you're dissatisfied with it, what I hope scientifically is we can do more of these studies and actually get a feel from doing the studies where that acceptable risk threshold is. Because right now it's not clear. Again, this study is so novel on its own, it's hard to tell. I want to do more. One of the things that just Friday, we found out this SWIG study in Southwest Wisconsin. We had a proposal into the state groundwater coordinating council to basically do the same risk assessment for that study. And I read the email very quickly, but it looks as if they're going to fund it. So we're going to be doing the same thing again with those Southwest Wisconsin studies. That'll give us one more data point to compare to look at. It's still a couple of years away, and it's only one more data point, so it's probably not moving as fast as you would like, but that's the scientific part of it. Is I would basically like to build up a whole library of these studies so we can look at a distribution to see where Kewanee and where really any other county in the state falls in that distribution.
Yeah, if I may, like you mentioned already for red waters, which is kind of, I assume, beaches.
Yep.
You know, there we have clearly no flag, yellow flag, and red flag.
Yeah.
And I think what you mentioned there was 10 out of 10,000 or whatever. You know, so, and I know that comes from EPA approved risk assessment, you know, which is basically statistics.
Yeah.
What is the risk that you get sick? So we have at 1,000 units, the yellow, sorry, at 235 units, the yellow flag goes up, at 1,000, the red flag goes up. And then, because we have a problem on the beaches here as well. So there apparently, which I would call a red line, the red flag says, okay, no swimming, you know, or swim at your own risk. So I'm just baffled again, and I know this is not a criticism about the presentation, that there is no red line for drinking water. I mean, this is the most basic human right to have safe drinking water in the richest country of the world. And here we are, you know, we're testing for 20 years and, oh, well, you know, let's test some more. I mean, and that's not a criticism. I think because the next step from with all this testing is, in my opinion, you know, somebody from the health department should step in and say, okay, we take it from here, this is not acceptable. And I'm completely missing that in here. I mean, we are not a third world country.
The question in the chat too that I want to ask. Michael Walk was asking, after completing your research at Kewaunee County, do you plan to explore other counties with karst features?
So the Southwest Wisconsin work that I just mentioned, they're not as well known for it and it's not as widespread, but they do have karst in that region. So that's kind of the next thing on the docket. We'd of course like to do more, but we have to kind of take the opportunities as they come. So that's the next one we can tackle. Yeah. So, sorry.
Keith Muessler, just trying to play back some of your data there that confused me. I've been under the assumption for years that there's a high percentage of contaminated wells in Kewaunee, and certainly they have a much higher density of cattle open, you know, concentration than we do here in Door County, but very similar structure. And one of the graphs that, and I'm not sure the unit, that in a urban area, 1% or 1 was the acceptable level, and in a rural area it was 30. And again, I'm trying to remember back, but yet the Kewaunee fell about in the middle in the bandwidth for there you go, public water systems. You know, it just struck me in my mind, maybe I'm picking up on his point, is that I've been traveling and a high percentage of people in Kewaunee contaminated wells, which certainly is helpful. Number 2, go to sell my home and your well's contaminated. Going deeper isn't going to help you. I just that, and then your point around, well, and they had 300 and some illnesses in Kewaunee last year, and I don't know, it was like 1.5%. It almost, your dad almost was presented like it's not that bad a deal. It's kind of the way I received it.
Well, I mean, the point here is that based on comparing it to the other numbers we have, we really can't tell. It could be that all of these numbers are high, or it could be that Kewaunee is sitting in the middle of the distribution. This is kind of what we've been getting at with a number of their questions and comments here is, it's with the data we've got, it's hard to tell if this 300 is high risk or low risk. It's not clear from a scientific standpoint.
And I'm not trying to be critical of your data at all. It's just, it seemed to be a disconnect on what I've understood or watched in Kewaunee and the data. And maybe it is, as he pointed out, vague. And you're not able to say, hey, here's high risk, you're not. That just struck me as something different than what I was expecting to hear.
Maybe the one other, I get to you, just like the one other comment I can make, just to point out is this is a countywide average. So it's taking in the areas that are kind of bad, so to speak, and maybe not so bad. So it doesn't mean that there aren't areas in the county that do have high well contamination rates. What this is saying is if you just look at the whole county overall, this is the number. Yeah.
at the end, you were showing, you know, if you want to address it, that's well more than 20 feet, but around 20 feet of soil above bedrock and all that. But actually, it seems to me what you were testing was the groundwater and not the well. And so in connection with that, when you were testing, did you simply test for above the detection level for all of these? Or were you also testing for relative quantity in the particular well samples? And did you map them to get a flow map of where you've got high concentrations, low concentrations, rather than well by well?
Good question. We didn't do any of the mapping. But yeah, I mean, that observation is, yeah, you're focused on the well because that's where you have to sample, but we are interested in the groundwater as kind of the subject.
But my point, so when you say address a well where you got more than 20 feet of soil above bedrock, I think what you're really saying is not the well, but you've got to put some sort of filtration system on the well, or find a different aquifer to tap that isn't contaminated, right? I mean, if you put
Potential
another well-
solutions, I don't know if there's another aquifer to tap there, but it's.
I mean, if you put another well to the same aquifer, you get the same test, right?
Conceivably, I mean, we're kind of mixing up. There is even within a single aquifer, you know, it's not homogeneously mixed. The contaminants move through in space and time. So there can be a lot of variability in the aquifer apart from the variability that might be associated with the wells that are drilled into it.
Which is mapping may help you figure out where.
No,
And final question. How many of these pathogens biodegrade and over what period of time?
so they'll all decay naturally in the environment. The periods of time involved are probably on the order of weeks to months. But if you start with a high enough source load, you know, a lot of, you know, maybe 90% of it goes away. But if you started with a really big number, 10%, a big number is still a big number. So yeah, they decay weeks to months. Some of the transport times here are very fast, like days to weeks instead. And then, you know, you never get rid of everything.
I'm interested in where the water is going. So my understanding is that basically water is flowing through this dolomite. From the bayside, it flows east. So there's a general flow. And is that correct?
That part I couldn't tell you. I'd need my hydrogeologist here. I would need to phone a friend.
Oh.
That part's outside my area of expertise.
Okay.
I'm sorry. Yeah,
Yeah, this is an easier one, so. But if you talk about septic systems, and we all know you have different septic systems. Was there any comparison? I mean, first of all, you have the H, and then you have what you call a mound system, which I suppose is really a septic system as well. And then you have the tanks, you know, which might be leaking. So and the reason I'm asking that is because I think it's important for not only health people, but the feedback, say, from your test to perhaps the health department or standards of how to engineer systems. You know, I mean, we can do a lot about that by engineering system, and I know wells design has been upgraded over the last many years or decades. And I think this is important information. If you have that during your test to get feedback, perhaps we need different designs in septic systems. And what was the age of the septic system?
I feel like I have to keep hunting to collaborators. I'm going to only try to do that a little bit here. So the septic system analysis that was led by another member of the team. I hope I'm not about to misquote our results. My recollection is that for the septic system associations that we got, there was nothing systematic with respect to like age or type or maintenance. It was just if there's a septic system there, it is a risk factor. That's my recollection. You know, a well operating septic system is still, I mean, it's designed to discharge. So, and if you're not removing the pathogens during that treatment step, then you're just discharging them. So and not to say that, you know, upgrading a septic system is a bad idea, but it's kind of like the well construction. It didn't show up in the results in terms of like the type or the age of the septic system, other than just the septic systems in general.
Yeah, and because the other thing, and you probably have heard it about what is the last year about Casco, the new subdivision. Where they have problems, and I don't know you, I think Stevens Point is involved in that. But I find it interesting because here's a new subdivision. And with septic systems, I assume, correct me if I'm wrong.
No, there's city sewer
And they have problems, actually, pretty high problems.
City sewer.
Oh, well,
Yeah,
if
that's
it's
correct.
city sewer, then
Where's
that's so.
it coming from?
So, I mean, if this is city sewer, I assume, and correct me if I'm wrong, then the septic system is not the source of the problem.
Right.
And this is now a recent subdivision. So, I mean, I think that might be very interesting for USDA to look in that source there, because that rules out the septic systems.
I'm aware of the Casco, the nitrate problem there, and correct, it is city sewer, but I don't know any. I'd be putting my foot in my mouth instantaneously if I said anything else other than that. So, but yeah.
I have one more question.
Sure.
It refers to this drawing and the one previous to this is how you're, because you have a logarithmic scale, which is fine, but your logarithmic scale in one case is per 1,000 people per exposure, not per year, and the one down below is 10,000 people per year.
Yeah.
And it's, so you've got, you can't compare the two in this case with the scale that you've got. Now, if you go to the previous one, if you carry that over to this one, then you get off the charts on the top.
Well, this is what I was, you're very astute. This is what I was alluding to when I was saying these two standards are hard to compare on the same scale.
Again,
They're just totally different.
one doesn't agree with the other.
No,
Well,
Okay.
the second one is exponential.
Yeah. Because it was 32 people, 32 cases per 1,000 people. And if you put 10,000 up there, then it would be 320. And that would be way the hell up here. And then the average would be somewhere in between, and that is only per exposure. And this one is down here for cases who are exposed every day for 365 days. Boom, that one goes off the chart.
I mean, I think so that if you were exposed to EPA's rec water risk threshold every day for a year, you would get sick more than once in a year. I mean, that's what's showing up on that.
For exposure event, so that's a per year scale on top.
The top is per day, essentially. And the bottom is per year. So that when you get to those numbers on the top, if you were exposed to that every day for a year, you're gonna get sick. Well, I don't know. I guess it'd be like 10 times a year.
So that top one should be way over here. Anyway, it doesn't compare. I mean, it's mathematically an error.
But it's not an error. It's a difference between the scales, but it's not an
Oh,
error.
yeah, you agree with that. Okay.
Yeah.
So Kiwanee doesn't have a hospital, and I'm just wondering where you did get your data for illness, because it's kind of unique where we are, because people go to Door County, they go to Milwaukee, they go to Madison and Green Bay. I mean, it's really unusual, I think, with healthcare in our area, so was that difficult for you?
It's actually not. If you're interested, there's a state website that publishes these types of data for every county in the state. I think they do it every year. You know, when you get below the level of that report, that's a state report. When you get below the level of that report, I'm honestly not sure how they're collecting their data from the health agencies. But those are county level data that I believe come from the county health department, and they end up in the state's hands. But they're publicly available.
So the hospitals report to the health department, is that what you're saying?
I believe, well, so for reportable disease like cryptosporidiosis, if the person went in for it, got tested, and it comes back positive, the hospital is supposed to report that to the public health agency. I believe that the person resides in. But again, that chain of reporting gets broken in so many places that very few of the actual cases make it to the state level agency.
So do you think maybe that impaired some of your numbers as far as accuracy?
The state reports,
Yeah, just true numbers of illness versus what's reported.
I mean, the main results of the study that we're reporting are basically derived from the pathogen current study. So we're using the state health data to compare to, but those state health data are not in and of themselves inputs for our results. So it's, you know, maybe it would affect, if you're inaccurate, it might affect that comparison, but it's not affecting our results directly. Is that? Okay. And when?
So you had the chart that showed that, you know, there was I think it was something like 300 of the incidences were caused by bovine contamination. The other was, well, the smaller one, like 12 for the human. For that 300, was that caused by a greater level of pathogens in that? Or was that by the volume? Do you have any idea as to, you know, what caused that disparity, you know, compared to the earlier charts that showed, you know, the same percentage of bovine and human, but you showed a greater number of illnesses, I guess it was?
It's, yeah, no, it's the 240 bovine. And it's a combination of factors. I wish it was straightforward to explain. This is the main piece. A large chunk of that 240 is Cryptosporidium parvum, and it happens to be in wells, contaminated wells in the deeper depth to bedrock category. So it's, you know, it's the pathogen presence and concentration that's kind of the proximate cause for why that chunk of the risk estimate is larger. That is probably driven by, you know, the real world factors of depth to bedrock and where the bovine fecal sources are. Yeah.
Are there any plans to do a similar study in Door County, or has one been done, to your knowledge?
None that's been done, no current plans. It would certainly, I think for obvious reasons in terms of the geography and hydrogeology and the soils, it would be of interest.
So maybe it's not
scientifically, but
necessary that Kewaunee County is sort of similar in terms of geology.
well, you know, you could assume that, but you know, science has a long history of disproving assumptions. I guess I'm gonna get into trouble here. Doing research, I just always want more numbers. So yeah, I would love to do a study in Door County because it would give us another number to look at and think about kind of the larger distribution. I guess I shouldn't guess at what the results would be.
Who would we talk to initiate something like that in Door County? Who'd be the power brokers?
Yeah, you know, I'll say this, the place we've gone most recently for funding this sort of work, and it's something that, you know, it's something that we do ourselves, but the state has this groundwater coordinating council where they basically take proposals and farm them out to a number of different agencies that would be interested in funding them. The key piece for us to do that kind of work is having some local stakeholders interested in it. That always gives us a higher chance of success.
Thank you.
Yeah.
Yeah, Dick Swanson, from Algoma. I've been around this issue for a long time. And it seems we come back, Tucker, to depth to bedrock a lot. I mean, in every single study.
Yeah.
Now, Maureen has said some pretty powerful statements about 50 feet or more. That's not practical. We know that. But do you think it's time to stop spreading liquid manure on land less than 20 feet? Would that change these graphs, even if we only tried it for 2 years or 3 year program? How do we fix this?
Yeah, you're not gonna be happy with this, but the policy part of it, what should be done, that's just not something I can. I have to stay in the scientific realm, so I can provide information that informs those questions. I can't tell you what you should do. Sorry.
Of all the things up there on your chart, is that something that can be filtered? All those things eventually end up in groundwater. So is that something that is even possible to filter? Either on the human side or the people side, or the bovine side, I should say? Are those, everything that you got up there, the E. coli, the crypto,
Yeah.
all those things, is it possible even to filter those out? Because you had talked about starting with a lower load
Yeah.
at the front,
Yeah.
then it's possible to filter them?
Well, there's natural attenuation that happens in the environment. If you kind of just leave it at that, you have, you don't have a boatload of control over what's going on. So you may get filtration if you're in the right spot, you may get no filtration if you're not. I don't know if that answers.
Well,
the
you
question.
you build a mound system to filter
Yeah.
humans.
Yeah.
Does the ground in the topography here allow that to happen with the boat? Is it even possible? Some people are throwing up 5 feet, 20 feet, 50 feet. Is it possible for that to happen realistically? Or is that crypto always gonna be there from a natural bovine?
Hmm.
You did a great study,
Yeah,
and we found out that depth of bedrock really doesn't filter everything.
it's should clarify. A big chunk of why that deeper depth to bedrock is important in the risk assessment is not, there is some attenuation happening, some filtration, to use that terminology, happening between the source and the well. The issue is that it's not complete. And there are just so many people with wells drilled in that deeper depth of bedrock category, that kind of the sheer mass of those numbers, overwhelm whatever attenuation you did get from the environment. So sorry, I'm getting a little lost with that. Some filtration is possible. Putting a number on it or saying, is it complete? I mean, we can't answer that with what we've got here. That's.
Okay, do certain soils do a better job at filtering these pathogens than other soils?
Yes.
Okay. That's what I-
Yes. If you ask the follow-up question of which ones, I've got to go in front again.
Okay.
Yeah.
Keith Bancroft, just continuing on with depth of bedrock. So if you just look at the folks with the private wells at 0 to 5 feet.
Yeah.
And if that was the only numbers, what would their risk? Because I mean, they get averaged out because they're a small number of wells compared to the rest of the county. So their risk is actually much higher than everybody else in the county. And this dilutes that to make it look like, well, in the county, we're just average. But in reality, there's a part of the county that to me looks like it's really got a serious problem.
I don't think I would disagree with I guess I'd have to double check the numbers to actually see if it is larger. The contamination rate is certainly higher in that shallow depth of bedrock for nitrate and coliform bacteria. I'd have to look at the risk numbers to see how like illnesses per capita split out between those two. But yeah, I mean, if that's the case, it'd be a fair point. I guess the main objective of the study here was to look at the overall countywide number. But yes, I mean, there are areas that have higher contamination rates than others. So I want to move. Sorry, I've been looking at this side of the room the whole time. I should come up here.
Okay, thanks, Tucker.
Yeah.
I'm just looking at this unknown fecal sources. And
Yeah.
of course, you know, I hunt out west, so I know what Ph.D. is. And,
Yep.
yeah, I was a former extension agent here for 13 years. I know we don't have any bees. So, you know, again, I'm questioning you. What do you think some of these unknown fecal sources really could be?
So there's two layers. I mean, one is they could be some other, you know, non-human, non-bovine. So it could be, we didn't have them in the lab at the time we did this study, but there's a whole suite of markers for, say, like birds and wildlife. That's possible.
Yeah.
The other thing that happens is the methods we use are not 100% diagnostically sensitive. So it could be, we tested a sample, we got no human markers, no bovine markers, but one of them was actually there. It was just at a low concentration and we couldn't find it. So that's,
I wonder.
Yeah.
Yeah, because you know, if you'd have known, it could, you know, skew whichever direction.
yeah, no, that's, I sat and looked at that chart and wondered if those numbers go in one of the other columns of it, so, yeah. But up at the top there, I haven't answered a question from you yet.
Follow up a little bit on Mr. Swenson's question too. Do you have any plans to do this study again? Get a little more recent data? Because when I look at this and I say, well, 2016 studies, and I know that there's this, we want to mold science and policy together. You know, when we look at that, well, 2018, there were new targeted performance standards that were passed for nutrient management plans and some, and solarium dolomite. So really that should have affected some of the practices I think that he's alluding to. So is there any plans to do any more updated studies looking at it now that some things have changed even on the policy side from the plan?
Yeah, I mean, in terms of concrete plans, the short answer is no, not at the moment. I would like to, because I've heard this, as for lack of a better word, I've heard this argument before that things have changed in the county.
I'm hopeful.
Yeah. No, okay. Yes, and so if things have changed, that is a great reason to go back and do the study again, and let's put a number on that. How well do those new things work? How are they affecting contamination rates? Are they affecting, if we were to do a risk assessment again, how are they affecting the numbers we talked about today? So, I would like to. We don't have concrete plans. It depends on funding, and kind of like the answer I gave before, it depends on having local stakeholders, local collaborators that are basically willing to go into it with us to track down the funding to do it. So, but I would like to.
And wait, one more quick thing, one thing.
Sure.
And how much does it cost? Like, how much more is it to do actual like epidemiology versus not?
A lot more.
Do you have any ballpark? Just because, you know, when I look at all the different sides on this issue, you know, and who believes what results when they come out, that always seems to come up. So how much more is it? Is it just not even feasible to think about it?
Well, it's okay. I can give you like very, very rough. To do it modeling the way we did, you're talking tens of thousands of dollars. To do it with EPI, and I would be all for an EPI study. EPI is the gold standard. You could measure the outcome that we're estimating here. But the EPI, you probably, just off the top of my head, I'm guessing like hundreds of thousands of dollars. It increases very quickly when you're doing EPI because there's a lot more people involved on an EPI team versus the way that we do the risk assessments with the lab. So the EPI is more expensive, but if if the funding was available for it, that would be the thing to do, would be the epi study.
Any RFPs for it?
Oh, that's a good question. I don't know. I'd have to look.
Yeah, I mean, going back to the epi, we can do another 100 epis. If we don't have a red line, where do we stop with that? Right?
Yeah, no, that's, okay, so fair point. I guess too, the other thing I have to think about, and sorry, I thought about this late as you were asking your question, with epi, you know, with epi measuring it, there is this, well, yeah. It's gonna get too technical, I guess. There's a lot of controls that go into it where you've got to have a very, very big study to look at the effect you're looking at here. So that's another reason why it's so expensive. So, but yeah, fair point. I mean, the epi part of it's not gonna solve the fundamental question of, is it higher or low?
Yeah, and that's basically what I'm getting at. I mean, if we don't have a red line, I mean, with that philosophy, you know, we wouldn't have any seatbelts or airbags in the car either. My question is that, how many deaths does it take to really step in and say enough is enough? You know, because, and I'll keep it short, it's, you know, we didn't even touch on mitigation. And, you know, after hearing all of this and the statistics, you know, we still going on with expanding, CAFOs. You know, and that's only a slight thing. So, I mean, there's apparently no worry, whatever, we have no red line, so everything basically goes, and that's my personal comment.
We're coming up on about 4:30, so maybe another 2 or 3 questions and we'll wrap it up then. Okay.
I'm gonna try to go with someone I haven't called on yet, right in the middle there.
What had, I experienced drilling one well, and that was 40 years ago in the county of Baptist in Door County. And I had to case my well to 150 feet, yet none of your statistics show anything about casing. And the reason why I'm exposed to casing is for pollution. Don't you think your statistics should have some kind of a notation of whether they were cased or not, and how deep?
So we know for every well in the study, we know how deep the well is, how deep it was cased. We have all of that. The reason I didn't talk about well construction much is that's in the first paper that I showed at the beginning. So the focus here was,
Sorry.
yeah, okay. So we had well construction in there. We looked at all of that in detail. The well construction in general didn't shake out as being important relative to land use and hydrogeology. So in this setting. Yeah.
Are you familiar with the AEM survey results that were done for Southern North?
No, I'm not.
I'd like to share this with you. It's a map that shows the depth to bedrock. This area in Southern Door is very active. Well, the Anape River is here, the watershed, 2 watersheds in there. This is high water table, thin soils. And I was told that as you traveled north along the Niagara Escarpment, the bedrock becomes more fractured and porous as you go north. So we would love for you to do a study right there before it's too late.
May contact you for a letter of support.
Yes, I'll do it.
We got one more question, last question.
Yeah.
I just want to say thank you for your presentation. And I want to, everyone that's in this room, it's pretty obvious to me that all this data, and you do more studies and you do more studies, and there's more data and more data, and nothing is going to happen except it gets presentations, etc. It'll get shelved until there is a mass casualty event. At which point the CDC is going to step in. And it's gonna force stuff. So we don't want that to happen. So my suggestion, each person here, contact your legislators, both state and federal, and get on their asses about this so we can get this manure out of our water supply. And nitrates and phosphorus and all this other stuff. That's my opinion. I don't want a casualty of it again. You know, data isn't gonna stop that. We've got to stop it and we've got to make it happen with our legislators. Thank you. I'm my
So-
horse.
You can wrap it up then. And I'd like to thank Dr. Burch for his presentation, and maybe he'll be around after we finish here if you wanna corner him or catch him someplace here.